I'm going to go ahead and mute all of you. If you need to ask a question, feel free. So I'm going to try something a little bit new tonight, and that is we're going to see if I can play a video for you. And it's the video on the diaphragm. Can you see that? It's in the, you should see the mechanics of respiration. Can you see that? Oh, I muted you all, so of course you can't see it.
The primary muscle of respiration is the diaphragm. The diaphragm is a thin, dome-shaped layer of muscle and tendon that separates the abdominal cavity from the chest cavity. It gains its shape from its attachments and from the organs that surround it, especially the heart, lungs, and liver. The diaphragm attaches at the costals along the lower rib cage, high in the front at the sternum, and deeply in the back along the spine. The diaphragm also attaches to itself via a central tendon, making the diaphragm one of the unique muscles of the body. The diaphragm uses its central tendon and its attachments as leverage to flatten during inhalation. The expansion of the ribs comes from the resistance of the internal organs to downward movement. As the internal organs are slow to move, the ribs expand to make room for the lungs. While the diaphragm attaches at the bottom of the ribs, its range of motion never reaches that low in the body. As seen from below, we get a sense of the full range of motion of the diaphragm as it would glide over the aorta, the vena cava, the esophagus, and the internal organs. For more information, visit www.3dyoga.com.
Was that cool or what? Okay, so what we're talking about tonight is not only the breath, but trying to get a little bit more expansion. Hi, Sarah, glad you made it. A little bit more expansion into our lungs, because when you don't expand your lungs, particularly the lower back lobes, you get what we call atelectasis. And atelectasis is the collapsing of those airways. And when you have a collapsing of the airways, that's when infection can get started. So opening up the airways is really important. What we've learned in COVID, you might have seen that a lot of the ICU patients are laying on their belly because there is more. It looks like Lori needs to be admitted again. She must have gotten kicked out. There is more lung tissue in the back of your lungs than in the front of your lungs. And when you lay on your belly, opening up the back actually becomes easier. And that's why we often do crocodile pose, because that helps you open up the back. We're also going to do alternative breathing. So Dave, you're breathing with the inhale coming up. Instead, you exhale coming up with the ribs down. We've done this before, but what that does is when you put the ribs down, when you raise your arms, it stretches the rib cage. The rib cage is not only attached on the back to the spine, but also on the front, on the sternum. And because there's so many ribs, it gets really sticky and hard to move. And many of us don't move very well in our rib cage. So there's three things that help: extension, flexion, lateral movement to both sides. Oh, I guess there's four. And then twists. So that's what we're going to be doing tonight, is extension, flexion, lateral movements, and twists, which are all great things to do in the evening because they're all things that help with going to sleep. So we'll start on our backs in constructive rest. And allow yourself to arrive, to be present. Maybe taking a couple of deeper breaths and allowing to the exhale to go all the way out. So we start with the three fundamentals. Feel how you connect to the earth, finding your stability with your grounding. Feel how the back of your pelvis is connected all the way down your feet, your chest wall, and the back of your head. Then bring awareness to the roof of the mouth and invite open spaciousness, dropping the tongue away from where it likes to be stuck, and unclenching your teeth, which is our natural reaction to stress. And then imagining more space between your ears. And invite that same spaciousness across your forehead, between your eyebrows, across your cheekbones, spaciousness across your collarbones, chest wall, spacious along the lower back. Wherever you're holding on to tension, do your own personal body scan and invite openness. And then we come to our breath. And just notice your inhale and your exhale. Remembering that when you inhale, the diaphragm comes down, pushing the belly up. Rib cage goes up and out because the resistance of the organs pushes those ribs up and out. And when you exhale, that's the passive part of your breath. Your ribs come back down, your diaphragm goes back up into the chest, and your belly falls. So when yoga first came to America, everyone talked about belly breathing. This was in the 40s, 50s, and 60s. And all the yogis were doing a lot of belly breathing, and many of them ended up with low back pain. And then in the late 60s and 70s, the exercise enthusiasts came in and they said, core strength, and everyone was working on core strength. And it turned out that a lot of people weren't able to sleep and were very anxious. So we find the middle path, the middle road, where we have belly breath, but we also have a little bit of core resistance. So as you inhale, allow the belly to rise. As you exhale, a little bit of pelvic tone, just 10%, and a little bit of lower belly tone, just 10%. Not all the way, not like we did before with zip up your pants, but maybe zipping up a pair of jeans that fit pretty well so you don't have to suck it in that much. So practice that for a couple of breaths. And when you have that pelvic tone, imagine that it's kind of like having a little trampoline there at the bottom of your abdominal contents. And when you inhale, the organs bounce off of that pelvic tone and goes back up to assist with the diaphragm with the exhale as it goes back into your chest wall. Just see if you can feel that, if you can sense that. So find your block and put the block between your thighs. And you probably don't want it on the widest. You probably want it on the medium or maybe the next size, whatever sort. You want your knees to come out directly from your hips. You're in constructive rest. With every exhale, press in on the block. With the inhale, release. So we've done this many times. It's called Uddiyana Bandha Wake Up. And the Bandha, Uddiyana Bandha, is between your pubic bone and your belly button. So with every exhale, press in on the block and notice where the tone comes in. So you're not squeezing 100%, you're just doing it softly to get that 10%. Now, if we were going to continue on for a deeper core buildup, we would take our knees up, but we're not. Instead, we're going to do thymus opener. So you can forget about the block for a minute and instead bring your awareness to right around your voice box. That's where the thymus gland is, and it's responsible for helping us with the T cells and immunity. So what we do for the thymus opener is you press down with the back of your head and your elbows to open up your chest and your neck. With the exhale, you relax. With the inhale, press in with the back of the head with the elbows, and with the exhale, relax. One more time, opening up thymus opener, and then relaxing. So now we're going to add that on. So inhale, thymus opener. Exhale, press in on the block. Inhale, press into the back of the head and the elbows to open up the chest. Exhale, press in on the block, and the chest comes back down. One more time. Inhale, pressing in with the back of the head and the elbows. Exhale, come down, press in on the block. And then just return back to your normal breath. You can remove the block, bring your knees into your chest, give yourself a rock and a roll. And rolling over onto your side, making your way onto tabletop. So in tabletop, your knees are directly under your hips. Your hands are directly under your shoulders. Gently draw the lower ribs into the back of the body so that you have that core support. Then as you roll your belly forward, roll the pelvis forward, and you open up your chest in cow, it's a thymus opener. And then press the floor away from you and you go back into cat. As you inhale in cow and exhale in cat, you're doing a thymus opener in cow and you're opening up the front of your chest, and in cat you're opening up the rib cage in the back of the chest. We're also warming up the shoulders and the hips. One more time. Opening up in cow, opening up the back of the body in cat. Then coming to tabletop, gently drawing the ribs in so you have that support. Wag your tail to the right, looking over to the right. Here's our first lateral spine move. So as you're looking over the right, your whole left side of the rib cage is opening up. With your exhale, coming back to center. Inhale here. Exhale, wag your tail to the left. Now you're opening up the whole right side of your body. Couple of breaths here. Remember, we allow the breath to do the magic to provide the fascia, the slide and glide that we need. And coming back to center. We'll go again to the left, to the right, Coming back to center, over to the left, coming back to center, and cat-cow. Opening up the back, opening up the front. And coming to tabletop, we're going to do thread the needle. So you bring your weight onto your left hand. The right hand goes out, goes underneath the left, and comes all the way down until your right cheek comes down onto the floor. Reach with your right fingertips away. You're opening up between your shoulder blades, and you're providing that twist. If you like, you can take your left hand onto the sacrum, or you can raise it up towards the ceiling. I like to have that support down on the mat so much weight isn't on my side of my head. But you choose whatever feels best for you. Then push down to come up, and again, 2 cat-cows. And when you come into tabletop, bringing your weight onto the right hand, left arm goes out, left arm goes underneath the right armpit, slides all the way out, left cheek comes down to the mat. Really reach with those fingertips away so you can feel the breath between your shoulder blades, underneath that left shoulder blade.
If you like, you can take the right hand onto the sacrum, fingers pointing down, or you can take the arm, fingers towards the ceiling. And you can always have your hand down on the mat, providing a little support for your head. One more breath here. Then push down to come up, and again, 2 cat-cows. And then with the next cat, go all the way back to child's pose. Reach your fingers forward as you reach your sits bones back. So we're reaching, opening up our chest wall. Take the right hand over onto the left side. There's our lateral spine movement, opening up the right side of our chest wall. And then take your right hand over to the right side, left hand on top of right, and opening up the left chest wall. And then taking the left hand over to the side, child's pose. Then pull the floor towards you as you come up into knee up dog, rolling your arm bones out, opening up the front of your chest, letting the tops of your feet ground and opening up the thymus. Knit your ribs to provide the support for the lower back. If you like, you can curl your toes and raise your knees up off of the ground. And then push with the floor, with the hands back, and pike your bum up, and you're in down dog. Now, I don't often talk about this in down dog, but pause and think, what is happening to the diaphragm? In down dog, you are exercising the diaphragm. Every time you inhale, it's pushing against all the organs. It has to work harder. But when you exhale, it helps the exhale because the weight of the organs assists the diaphragm going back into the chest wall. See if you can feel that. And then end of the exhale, bend your knees deeply, look up between the fingertips, and then just pause here for a breath, another thymus opener, and then push off with the feet and walk your feet forward. Inhale to lengthen, exhale to fold. Push down on the feet to come all the way up and back to mountain. So I find the opposite breathing to be really difficult for my brain. Let's see how you do. So instead, what we're used to doing is we inhale when we take our arms up, right? That's what we're used to doing. So instead, we're going to have our hands by our side. Inhale here. Exhale, arms come up. Knit your ribs down. Inhale, arms come down. Exhale, arms come up, ribs come down. Inhale, arms come down. See if you can do that a few more times on your own, where the exhale, arms up. Inhale, arms down. Now we're going to add on the heels. Exhale, heels up, arms up. Inhale, heels down, arms down. Exhale, heels up, arms up. Coming back down with the inhale. Now let's put our hands on our hips. Slight little bend to the knees and twist to look over the right shoulder. You can take your left hand onto your right hip and the right hand behind, reaching your fingertips around your waist, and then come back to center and stand up. Slight little bend to the knees, look over the left shoulder, right hand goes onto left hip, left hand comes back. Remember, the belly button keeps going to the front of the mat. And then coming back, standing up. So we're going to do chair twist. So mini squat, hands to heart. Bring your left elbow over your right knee. Now maybe it hovers, or maybe you come all the way down and it hooks onto the outside of the right thigh. Another breath.
Feel what it does to your rib cage. And coming back to center. Inhale here. Exhale, right elbow over left knee. Look down and see if your knees, if one knee comes up. Pull that knee back so that they're equal with each other. That means your pelvis is equal. And come back, push down to come up. Inhale here. Exhale, heels up, arms up. Inhale, arms down. Exhale, heels up, arms up. Inhale, come into chair. Can you sink into chair just a little bit further? And then forward fold. Inhale to lengthen. Exhale, plant your hands, feet step back, down dog. So last time in down dog, we talked about what is happening with the diaphragm. This time, go ahead and pedal through your feet slowly. As you reach one heel towards the mat, the other knee bends. Push the floor away from you with your hands, so your nice long line between your fingers all the way to the bum. And then holding steady, reaching both heels towards the ground, but let the knees be nicely bent. With the next exhale, coming forward into plank. You can always come down into knee plank if you need to. Do your 8 to 10 push-ups. Remember, you can come down onto your knees to do them. You don't have to go down all the way to the ground. Just do what works best for you. Each one of us practices at our own level. And then come all the way down to prone mountain. In prone mountain, hands are down by your heart. Tops of the feet are grounding. Press down with the hands, pull back, end of the exhale, ground the pubic bone. Inhale, right between the shoulder blades, baby cobra. So we're really trying to get that opening in the back, between the shoulder blades. Exhale, coming down. Inhale, coming up. Look over your right shoulder. Baby cobra, looking with a twist. Exhale, coming down. Midline baby cobra. Exhale, coming down. Inhale, coming up, looking over your left shoulder. Exhale, coming down. Midline baby cobra. Exhale, coming down. Now, pausing here, bring your awareness to your heels. Pull them towards your sits bones to raise your straight legs up. Then coming up into baby cobra. We're now in locust pose. Take your hands back. Pumping the thumbs together. 2, 3, slowly. 4, 5, 6, 7, 8. Bring your hands, hand over hand, right cheek onto the back of your hands. Big toes touching, little toes rolling out onto the mat. That releases all the way up to your bum. Now notice in crocodile pose, more breath is going into the back of your body. One of the benefits of this pose is that very thing. You want more breath to go into all the way down into the lung spaces at the very base. So take one deep, deep breath and exhale all the way out. And then come back to prone mountain. This time we're going to come up into locust pose all at once. So ground the pubic bone. Inhale, legs come up, chest comes up, arms come up. Pumping the palms towards the ceiling. 2, 3, 4. Maybe opening up your neck for a thymus open. 6, 7, 8. Coming down again to crocodile pose. Left cheek onto the back of the hands. Nice deep breaths, opening up all of those lung spaces, all of those alveoli, all the way down to the very base of your lungs. And then coming back to prone mountain. Lengthen out through the back of the neck. Curl your toes and push back to child's pose. In child's pose, reach the sits bones back, reach the fingers forward, knit your ribs. Now we've got that opening of that chest wall.
Then pull the floor towards you, getting those back muscles working, and come into knee up dog, opening up your neck, opening up the thymus, opening up the chest. Thoracic extension. Curl the toes and raise your knees up dog and back to down dog. Every time we go through down dog, your diaphragm is getting the benefit of exercising against the weight of all the organs. Bend the knee deeply, look down, look up between your thumbs, open up your chest wall for a breath, and then step forward. Inhale to lengthen, exhale to fold. Push down to come all the way up, and back to mountain. So another great pose for opening up the chest is, of course, high lunge, because it's thoracic extension. So hands at hips, mini squat, weight over to the left side, right foot steps back. Projected lunge, hands to heart if you can, then taking the left elbow over the right elbow over the left thigh, you go into a twist. And then come back to stable, to normal, and push to come all the way up. Straighten the leg, sweep that right hip forward, pull with the left heel to bend. Push to straighten, moving with your breath. Next time knee bends, we'll pause here. Take the arms out to the side, palms up. And then open them up even more so your chest opens up. Open up your throat, there's the thymus. Can you keep the same openness as you raise your arms up? Maybe you stop halfway because that's where you start feeling a little crunch. Maybe you can keep it open all the way with your hands up. I like to stop about halfway. Remember to knit your ribs. And then tipping forward, arms go back, palms towards the ceiling. It is now humble lunge. Lengthen out through the back of the neck so that you're looking down at the mat, not up at the screen. That's better. Then gently tip that right foot forward until you bring all the weight over onto the left side. You're in airplane pose, or maybe you come all the way down into warrior 3. No matter how far you go, make sure that that back leg hip is rolling forward. Whether you be in airplane or whether you be in warrior 3. Wherever you are, keep that back hip forward. And we all join with the foot down and forward fold. Inhale to lengthen, open up the chest, thymus open. Exhale, fold, open up the back of the back. Push down to come up, grab onto your right wrist and over to the side, lateral. Couple of breaths here, opening up that whole right side, left side. Right side is getting a nice squeeze. Inhale, coming up, holding onto your left wrist and over to the right. Now opening up the left side. Nice deep breaths. The breath provides that slide and glide. And then coming up, arms down. Mini squat. Weight over to the right foot, left foot steps back. Let that left heel come down to the point where you would be in down dog, just resting. Then your hands to heart, shoulders away from the ears. Left elbow over the right knee. You can come all the way down if that feels comfortable to you, where you bring the elbow onto the outside, just like we did in the twist in the beginning, or you can just hover. And then coming back to center. Hands to hips, push the floor with the right foot to come all the way up, knee straight, more weight onto that back leg. Let that back hip roll forward. Pull with the right heel to bend and push to straighten. Good evening, so as. Anyone else feel it? I sure can. And the next time the knee bends, pausing here. So a different way of imagining getting that chest open is to come to prayer with your thumbs on your sternum. And where that thumb is touching to your sternum, imagine the great puppeteer in the sky takes a string from there and pulls it up to the ceiling as you open up your chest,
Open up your neck and your gaze. There we are with the thymus opener again. Thoracic extension. Choose where you want the arms. Maybe they come halfway up into a V. Maybe they come up into parallel lines. Or maybe you like that wide open stance. Knit your ribs. And then tipping forward, palms come behind us, gaze comes down, maybe 2 feet in front of your foot, lengthening out the back of the neck. And then kicking the left foot forward, transferring the weight onto the right, and coming into airplane pose or warrior 3. Remember, whichever one you choose, it's just a progression. Whichever one you choose, that back left hip rolls forward as the leg comes up. You can have your hands at hips, you can have your arms back like airplanes, or you can take your arms straight out in front of you. And we all join with the foot down and forward fold. Opening the back, inhale, coming up into cow, thymus opener, opening the front of the chest. Exhale, fold. Push down to come all the way up, grabbing onto the right wrist, over to the left, opening up the whole right side of the chest wall. Knit your ribs. Inhale, coming up, grabbing onto the left wrist, and over to the right, opening up the left chest wall. Inhale, coming up, arms come down, stepping wide. Do we know how to have a class and not do sumo? So sumo is all about pelvic floor strength. So let's just find how we can just bring 10% tone into our pelvic floor. And with the exhale, 10% tone into the belly, lower belly. Then inhale, lengthening the spine. Exhale, coming down into sumo. Inhale, coming up. Exhale, coming down. You're nice and long. You've got a neutral thoracic cavity. The ribs aren't really moving in this. Next time you come down, pausing here, right heel raises up, coming down 5, 4, 3, 2, 1, contact, push down to come up. Exhale, coming down. Raise the left heel, lowering down 5, 4, 3, 2, 1, contact, pushing down to come up. You know what's coming next. Coming down, raise up both heels, find the balance, lowering down 5, 4, 3, 2, 1, contact, pushing down to come up. Turning the left toes in, right toes out. So we're going to spend a little time here just because I want us to know that this pose is actually can be a twist if you take the full advantage. So your right toes are going towards the front or back of the mat, the short edge. Your pelvis is at your 2 o'clock or 10 o'clock, depending on which way you are. So for you right now, it's at your 10 o'clock. Now, can you take your shoulders to 9 o'clock without letting your pelvis move? So don't take the pelvis because that changes your leg and it pinches your SI joint. Let the pelvis stay at your 10 o'clock, but the shoulders go to 9 o'clock. Now you've got a twist between your shoulder blades. Pull with the right foot to bend and push to straighten. Moving with your breath. Always coming down back to, do I have good grounding? That back leg rolls out like we talked about last week. Am I relaxed? Shoulders away from the ears, tongue away from the roof of the mouth? And am I still exhaling? Next time knee bends, pausing here. Tipping over. Bringing the forearm down onto the thigh. Now push down with the elbow and open up the chest and look over your left shoulder. So there's a twist right here. You can stay here or you can let the arm go up. But the main thing is your left hip is rolling down, left shoulder is rolling back. Twist is between the shoulder blades. With the next inhale, reach for the ceiling, coming up into warrior 2. Flip the front hand, Reverse warrior. Now you're opening up that whole right side of your chest, straightening the knee and bending the knee. With your right fingertips, reach up towards the ceiling. So you're really reaching, really stretching that whole side body. And the next time you straighten the knee, hands down, feet forward, 2 sumos. Symmetrical pose between 2 unsymmetrical poses. And the next time you come up, right toes turn in, left toes turn out. So now your pelvis is at your 2 o'clock if your left foot is 12 o'clock, right? But can you get your shoulders to 3 o'clock without your pelvis moving to 3 o'clock? Let that pelvis just land where it lands, but bring the shoulders. Now can you feel the twist between the shoulder blades? Pull with the left heel to bend, push to straighten. And I'm noticing that now that I've had knee surgery, I need to wiggle my toes forward a little bit more because I'm more comfortable bending my knees. So I'm noticing that some of you, your knees are going beyond your toes. So make sure you have a long enough stance so that when you stop, the knee ends up right over where the heel meets the arch or on the heel. Next time knee bends, pausing here. Tipping all the way over, bringing your forearm onto the lower thigh. Right hand is on your hip. Let the right hip roll forward, right shoulder rolls back. So your chest is facing the full length side of your mat. You can stay here or you can take the arm up. Couple of breaths here, letting that whole chest wall, reaching with the fingertips, really letting the chest wall be open. With the next inhale, reach with the fingers up, coming up into warrior 2. Reach back with the right hand so that your shoulders are over your hips. Then left palm goes up, reverse warrior. Straighten the knee and bending the knee. Reaching with the left fingertips towards the ceiling so that you're getting nice extension along the whole left chest wall. And the next time the knee is straight, pausing here, arms down, feet forward, grab your block and place it between your legs. Then hands at hips, bump the heels out so that you look down at your feet and the little toe and heel are in line with the long edges of your mat. Inhale to lengthen the spine, exhale coming to forward fold tabletop. Bring your hands to the block, then reach the crown of the head forward, reach the tailbone back. Placing your left hand into the center of the block, push down with the hand so that the arm bone comes to the front of the socket and look over your right shoulder. Right hand goes onto the lower back. If you like, you can choose a different position of the block. And if you like, you can take the arm up to the ceiling. I find that my arm goes up better if I'm lower down. So you might find that you would prefer to have your hand on the mat or anywhere on the block, whatever works best for you. Remember, your belly button rolls back. Both legs are straight. Then exhale, coming down. Replacing the left hand with the right hand. Press down with the hand to bring the arm bone in the front of the socket, looking over your left shoulder. You can put your hand on the sacrum, or you can put your arm up to the ceiling, or you can have your hand on your hip. Whatever feels best for you. Another twist. Opening up the side body, twisting the spine. Belly button rolls back down to the front. And then slowly coming out of it. Inhale, lengthening, looking forward, opening up the thigh and thymus. Exhale, fold, letting the whole back of the body be open. The back of the chest wall, top of the head is facing, maybe it touches the block, maybe fist over fist on the block, maybe a different position on the block. Maybe you want to heel toe your feet out a little further to challenge yourself to a deeper, lower level. Choose what works best for you.
the two sits bones on your pelvis. Reach those sits bones back to the wall and try to raise them up the wall like you're painting two lines up the wall. It's going to tilt your pelvis. It's going to keep the lower back a little more steady. Then inhale, pull the floor towards you, looking forward. Exhale, fold, looking back. Inhale, coming up to tabletop. Then go ahead and heel toe your feet in. Press down with the feet and come all the way up. Heel toe, coming to mountain pose. So we're going to go into eagle's pose. If you like to use the block, bring it and put it on the left side of your mat. I like to have it on the lower level. You don't need it if you don't have it, Kathy. You can probably do without. So we've already done the squats, so we know about the squats. We're going to do one way where we do the arm first, and the next time we're going to do the legs first. So let's do the legs first this time. So it's a mini squat. You bring your weight over to the left side. Right heel comes up and over onto the block or the floor. Try to get the whole thigh over the thigh. Let the back knee reach into the front knee and pull the two thighs together, the two calves together. Then the arms come out. And right arm goes under left arm. Shoulders down, elbows up. If you like, the back of the hands together. If you like, the palms together. If you like, the toes come off of the block. And then if you can, reach the toes around the back of the calf. I can't do that because that just doesn't work in my body, but maybe it works in your body. Knit your ribs. Maybe you can sink down a little lower. Feel the breath between your shoulder blades. And then release, pushing down, opening up the arms, uncrossing the legs. Moving the block over to the other side. So this time we'll do the arms first. You know where the block is, you know what you're going to do with your feet. So we take the arms out. This time left arm under right arm, hands onto the shoulders, shoulders away from the ears. Once you get the shoulders away from the ears, can you keep them there and raise your elbows? Can you keep the shoulders away from the ears, raise the elbows and bring the backs of the hands together? Maybe the palms together. Mini squat. Shins forward, sits bones back. Then bring the weight onto the right leg. Left leg comes over. Squeeze the thighs together. Squeeze the calves together. Maybe you flex your foot so that the toe comes off of the block. You can go up and down just like we do with tree. Maybe you can wrap your foot around the back of your right calf. Breathe into the back of your body between the shoulder blades. Really let that go all the way back. And then releasing. And we're going to come down to the ground, but I want you to have something that you can sit on. So if you need to grab a blanket folded or a pillow or something so that we can practice breathing when we are ready to use it. So just have it ready. Take an inhale here. Exhale, arms up, heels up. Inhale, heels down, coming into chair. Forward fold. Inhale to lengthen. Exhale, plant your hands, feet, step back, down dog. Push the floor away from you. Reach the pelvis back, tipping it a little bit more. Then come through plank all the way to up dog, opening up the chest, a thymus opener. Let the knees come down, sink all the way back to child's pose. Reach the arms forward, reach the sits bones back. Feel that opening of the chest wall. Crescent child, right hand on top of left, opening up the right side of the body. Over to the other side, left hand on top of right, opening up the left side of the body.
And coming back to one hand on each side of the mat. Maybe the forehead comes down to the mat. Maybe it doesn't. Maybe you'd like to fold hand over hand and let the forehead rest on the back of the hand as you let more breath go into the back of the lungs, the back of the body. And then making your way onto your left side. Clamshell twist. If you want to put the block between your thighs, you're welcome to do that. If you have a pillow or a blanket, you can put that under your head. And you want to bring your knees up to your waistband at least. The feet are slightly flexed on top of each other, knee over knee, hip over hip. Arms are out in front of you. Right arm up to the ceiling. Exhale out behind you. And breathe. Here's another twist. Let your breath move your hand. Let your breath open up that whole right side of the body. Our chest wall gets so sticky. There's so many muscles and so many tendons and so many bones that many of us get very congested in our chest. A few more breaths here. And with your next inhale, arm comes up to the ceiling. Exhale down in front, resting breath. Breathe into the back of the body. And then roll over to the other side. Knees are tucked up by the waistband. Feet are lightly flexed. Left arm is in front of you. Inhale, left arm up to the ceiling. Exhale, arm out to the side. And breathe. The power of the breath. Feel how it moves your chest. And you probably feel where you have tightness in your chest. Those pec muscles get so tight because we spend our days in front of computers, driving cars, cooking, doing all those things where we're hunched forward. This is a great way to get that openness. And that twist is right between the shoulder blades. Inhale, arm up. Exhale, coming down. Resting breath. And then pushing up and making your way to seated on whatever you decide to sit on. We often don't take time for doing breathing, but actually that is part of a yoga practice. So we're going to do alternate nose breathing. Your legs can be either in cross-legged if that's comfortable, or if you prefer, they could be out, whatever's comfortable for you. Then you take your dominant hand and you take the pointer finger and the middle finger and put them right between your eyebrows. And you take the thumb and the ring finger positioned on either side of your nostril. Then there is a river that runs up and down from the sits bones all the way up to the crown of the head. Close off with your ring finger, the ring finger nostril, and inhale up through the thumb finger, up over the head, then close the thumb, open up the ring, and exhale out the ring finger. Inhale up the ring finger, up overhead, close the ring finger, open up the thumb, and exhale. It comes down to the bottom, inhale up overhead, go back and forth where you exhale on one side, keeping it open, you inhale up that same side, and then you close off and exhale through the other side. Inhale up and over, change fingers, down, all the way down to the floor, and then up, overhead, alternate nose breathing. I'll let you do it on your own. If you go to any Ayurvedic doctor, no matter what bothers you, no matter what your sickness, this is what they're going to tell you to do. It's part of most yoga practices. It's part of daily living in India. in case you've gotten mixed up. You inhale one side, and then you change when it's time to exhale. You exhale over to the other side, keeping that side open. Inhale through that same side. When it gets to the top of the head, you exhale through the other side, keeping that open. Inhale through that same side, closing and going over to the other side for your exhale. A few more rounds. Reach down through the sits bones, tall through the spine. And the next time you've come over and completed, you can release and just sit and notice what you feel. Let your shoulders relax away from your ears. Now, if you really would like to try something a little more adventurous, without your fingers, can you do that same breath? Inhale through the right nostril, try to exhale through the left nostril. Try to inhale through the left nostril and exhale through the right nostril. Going back and forth without using your fingers. It doesn't close it off completely, but maybe you can feel that a little bit more is directed. And then return to your normal breath. And making your way into constructive rest on your back. Arriving in constructive rest, the feet, back of the pelvis, back of the chest wall, back of the head. Relax your jaw. Open spaciousness across the whole head. Then bring your knees into your chest. Give yourself a rock and a roll. Left leg comes down to the ground. Right leg goes up towards the ceiling, straightening the leg as much as possible, flexing the foot and point. Flex and point. Circles. Circles the other direction. If you like, you can straighten out your left leg, flexing it, grounding it. Roll the toes out, heel in. Exhale out to the side. No strap. Notice it's much harder. Inhale, come back to center. Roll the toes in, heel out, cross midline. Back to center. Bend the knee into the chest, grab onto the knee, pull it into your chest, reach that left heel out, arm bones to the ground. Wind relieving pose. Feet really deeply flexed. And take the left hand to the outside of the right knee, drawing the right knee over to the left. Right arm goes out to the side, looking over your right shoulder. Back to center, bringing the right foot down to the ground, bringing the left foot down to the ground so that both knees are bent. Resting breath. Take your left leg up to the ceiling, flexed foot, leg straight, point and flex. Circles in one direction, circles in the other direction. Ending in flexed. If you like, you can take the right leg out, grounding it out and down. Roll the toes out, heel in, out to the side. Get those ribs knit. You've got to turn on that core support. You can look over your right shoulder if you like. And bringing the leg back up. Roll the toes in, heel out, crossing midline. Look over your left shoulder. Back to center. Bend the knee into the chest. Draw it in with your legs, with your hands, and you are in wind relieving pose. Point and flex. Point and flex. End in a nice flex. Then take the right hand to the outside of the left knee and roll it over to the right. Left arm goes out, looking over your left shoulder. Again, another twist. And then coming back to center, Bring your foot to the floor. Bring your right foot to the floor, resting breath. Bring your knees into the chest, rock and roll. Knees out to the side, soles to the ceiling, and you're in happy baby, rocking back and forth, massaging the lower back, massaging the kidneys. And when you're ready, bringing the feet together, the knees together, one foot to the floor, the other foot to the floor. One leg straightens out, the other leg straightens out, and you are ready for Shavasana. Maybe you'd like to put on some socks or a blanket. Do whatever it is that you need for your Shavasana so that you're comfortable. Come back to your 3 fundamentals. Feel how you are connecting to the earth. Surrender into Mother Earth's arms as you release the tension from the day, as you let your mind assimilate and integrate the movements that you've made in your yoga practice. Relax your jaw, your tongue, and let your breath move freely in your body. We'll practice 5-part breathing if you like. If you don't, then just ignore me. Let the next several breaths go into your belly. And let the next several breaths go into your breastbone, right underneath your breastbone. Middle lobes. And see if you can direct the next several breaths way up high above your collarbones. Then direct the next several breaths into the side bodies underneath your armpits. East-west breathing. And then allow the next several breaths to go deep into the back of your body, down into the lower lobes. And the next several breaths up further between your shoulder blades. And take a deep breath, including all of those areas: belly, chest wall, collarbones, armpits, lower lobes, shoulder blades. Exhale. Do that 2 more times on your own. Belly. And return back to your own authentic breath when you're finished. Slowly inviting gentle movement back into your body. Bending your knees, bringing your feet to the floor. If you like, bringing your knees into your chest, giving yourself a final rock and roll. And rolling over onto your side. Lingering, enjoying, savoring. And when you're ready, pushing up and making your way to seated. Oh, what the heck, let's get in one more twist. Bowing to your right knee. Nice deep bow. Feel that breath going all the way down to the left sits bones. As you reach that sits bones down, bowing to your right knee. Inhale, coming up. Bowing to your left knee. Keep that right sits bones down as you bow to your left knee. Feel it underneath your shoulder blades. Maybe you feel it in your back. And inhale, coming up. May all beings be happy. May all beings be healthy. May all beings be safe and free from danger. May all beings be free of any form of suffering. May all beings live with ease. Namaste. And I will ring the bell and stop the recording.